Hi, my name is Ravdeep, and today I will be presenting the prenatal education slash precautions. Before I begin, I would knock on the patient's door, pull the curtain for privacy, and introduce myself to the patient. Hi, Miss Gloria. My name is Ravdeep. I am your nurse for today. Dr. Smith informed me you are 3 weeks pregnant. Congratulations. Before we begin, I need you to confirm your name and date of birth for me. Okay. Any allergies that we should be aware of? No allergies. Okay. So the basis of our visit today is to go over specific prenatal precautions that you should be aware of and that you should be practicing now that you are pregnant. So if you don't have any questions, we will begin. Okay, so we can jump right in. So certain foods that you would want to avoid when you're pregnant would be uncooked foods such as raw meats. An example of this would be shellfish, sushi, and shrimp. A reason to avoid seafood is because it can increase the risk of an infection. You'd want to avoid unpasteurized products such as raw milk and raw cheese. These products tend to harbor bacteria such as Salmonella and E. coli, which can also increase the risk of a serious infection. And while it is not restricted, it is recommended that you limit your caffeine intake to at least 200 milligrams per day, as excessive caffeine intake during pregnancy can cause low birth rate as well as premature birth. Before you decide to take any new medication, it is recommended that you consult and inform your provider first. Generally, it is okay for you to take acetaminophen or Tylenol, over-the-counter antihistamines, and antacids such as Tums. However, you should avoid NSAIDs such as ibuprofen, which can cause cardiac defects. It can cause low amniotic fluid, which is essential for fetal development, and it can also increase the risk of a miscarriage. Blood thinners such as warfarin are to be avoided due to the increased risk of bleeding. And ACE inhibitors, which are prescribed for high blood pressure, are also to be avoided due to the increased risk of fetal death and heart defects. Retinoids, such as tretinoin, which are prescribed for acne, you would also want to immediately stop the use of this, as it can cause serious defects as well as fetal death. So if you are currently taking a retinoid, your provider will order you to stop use of the medication. It is recommended that you increase the intake of certain supplements such as folic acid, which helps prevent neural tube defects for the fetus, iron, which helps prevent anemia, and increasing your vitamin C intake, as this will help develop the baby's bones and help prevent hypocalcemia for your son. For environmental exposure, this can be a numerous amount of factors. So for example, household cleaning products, specifically those are high in ammonia and bleach, you would want to avoid mixing those products, as this can cause respiratory complications. Lead exposure, you would want to make sure that you're reading cosmetic labels. You would want to make sure that you avoid painting or partaking in household renovation projects, as this can increase your risk to lead, which can lead to numerous defects such as learning disabilities for the child. And then you would also want to avoid, especially if you work in the healthcare field, you would want to avoid radiation exposure, as this can cause numerous defects, specifically neurocognitive defects on the fetus. Consuming alcohol, smoking tobacco, and cannabis, using recreational drugs such as cocaine and heroin, just to name a few, is strictly prohibited. It can cause numerous effects on the fetus, such as premature birth, fetal alcohol syndrome. It can increase the risk of miscarriage while you are pregnant. It can cause numerous heart defects, and it can also increase the risk of your child developing a learning disability. And as for your own health, it can increase the risk of you developing hypertension. It can increase the risk of a heart attack or stroke, and it also increases the risk for seizures, as well as has a negative impact on the mother's mental health. If you plan to travel during pregnancy, it is advise that you inform your provider and consult with your provider before you do so. Generally, it is recommended that if you plan to travel, to do so in your second trimester, as this is when certain pregnancy symptoms such as nausea and vomiting tend to subside. It is recommended that you avoid traveling to areas that are known for outbreaks of malaria and Zika virus, which can cause premature birth and stillbirth as well. While you are traveling, it is important to practice good hygiene, stay hydrated, and it is also advised that while preparing for traveling, you do prior research of local medical clinics and hospitals in case of an emergency. It is discouraged for a pregnant woman to sit for prolonged periods of times, hence why it is advised that you take numerous breaks, you walk short distances, you avoid crossing your legs, and you keep your feet flat on the floor to avoid impaired blood circulation. As for dental visits, it is recommended that if you do plan on visiting the dentist, you do so in the second trimester of your pregnancy, as this is when your nausea tends to subside and it decreases the experience of discomfort. Just certain dental procedures such as fillings, cleanings, and extractions are completely okay to be done throughout pregnancy. If you do plan on having an x-ray done at your dentist visit, it is essential that you are provided with protective shielding to protect your fetus. Complications such as gingivitis, teeth erosions, and cavities are common during pregnancy due to hormonal changes, hence why it is advised that you continue to practice good oral hygiene such as flossing and brushing twice a day. And that concludes our prenatal education / precautions. I know that was a lot of information to take in. We will be providing you with an educative pamphlet that will list everything that we talked about today. Do you have any questions right now? Okay, no questions. And when you go home and questions do tend to come up before your next doctor's visit, you can always give us a call. I will follow up with your provider now, and we will book you out, and we will see you at your next visit. Okay? Thank you.